For some, the thought of starting something from scratch, especially a social enterprise system like he practiced, would have been plagued with uncertainty. But to Dr. Hassan, the international success of the Eye Foundation Hospital was not a surprise. Some would even argue that it was a goal he had envisioned from the start.
I was lucky to come back and start something unique. And when we go for international conferences like the American Academy of Ophthalmology, the Royal College of Surgeons conferences, and we present cases, what we're doing in Nigeria, what is this? They were shocked. How can we achieve this without external funding? And we told them that we run a social enterprise system whereby the private sector funded all the activities at the secondary level and at the bottom of the pyramid at the primary level. So we were well accepted. And within the period of my being here for 2 years, I was appointed to the board of the International Council of Ophthalmology, which is the highest board in the world of ophthalmology. And we earned this because they're hearing a voice from Sub-Saharan Africa. The voice they've been hearing is, come and do this for us. Come and do this. We need money. But we said, we're not asking for your money. We can generate resources, and the people with goodwill in Nigeria who can support that vision.
Dr. Hassan has also delivered lectures at various international conferences and submitted academic papers to international medical journals, and he shares some of his most memorable findings from his medical experience with eyesight in Nigeria, which he presented before the international community.
I think the first is the fact that the community health, high problems can be grafted on primary health care. If you go through most of the local government, the health centers, they take care of primary health care. So we trained about, in Ogun State, take Ogun State as an example, we trained about 18, then there were 18 local government primary health care centers. We trained the nurses there for 9 months as grafting primary eye care on primary health care. We call them the ophthalmic nurses, community ophthalmic nurses. And we're able to provide diagnosis and treatment of eye care at those centers. And that integration of primary health care with primary eye care was applauded as one of the easiest ways of getting to the poor in the community before complication arises. And only one is the effect of glaucoma. Glaucoma is more, which causes blindness due to rest pressure within the eye. It's more aggressive in blacks. The treatment given by the whites will not give us the appropriate response among the blacks. And this helped to direct focus on how best can we address glaucoma among the blacks. And this was also found among the blacks in America, the black Americans. And that helped us to focus and rethink on the best approach to treating glaucoma among the pigmented population.
However, the success story of the Eye Foundation Hospital was appreciated better among the international community, leading to bigger global footprints for the Eye Foundation Hospital.
If the international community and participations are recognizing us and are giving us accolade, and it's out of this sort of creativity and innovation in education, in giving the best to the younger generation, that I was given the International Council the Golden Apple Award, which is given only once a year. And I was the first African Nigerian to get that sort of award. So that impact internationally also made us available to clone what we've done in Nigeria in other countries. And the Hilton Foundation worked with Aravind in India and John Hopkins and us to clone our system, which we did in Kenya, in 2 hospitals in Kenya, in Zambia, and in Ethiopia. And where we created 5 centers of excellence for cataract surgery.